Hello, friends. Welcome to another session. We are moving on to the second recall, INI-CET, November 2023, Biochemistry. Like I said in the previous video, we first did the analysis of the topics being asked in INI-CET over the last 10 papers. We pinpointed 72 topics, out of which 12 were new once in a while asked questions, and 60 routine topics which have been repeated with some frequency. Some of them repeated in the past, some of them repeated more commonly recently. So we will do the detailed discussion of the topics separately. What we are doing just now, we are just looking at the questions in the specific exams, the options, and the possible correct answer without going into the details of the topic. We'll take up the topic separately. Every time we take up the topic, we'll highlight the questions asked from that topic, in which year, in which exam, and go into the topic in detail. We'll do a deep dive and make sure that you know the topic inside out, so that no matter how the examiner twists the question, you are able to confidently answer the question from that topic. So let's quickly start with this particular series, INI-CET November 2023 Biochemistry Recall Questions. So question number one, anticoagulant in gray container for glucose estimation. Your options are potassium citrate, buffer sodium citrate, lithium heparin, and sodium fluoride with the sodium EDTA. Now, all of you know in the gray vial, you must have the sodium fluoride. What you have to keep in mind that sodium fluoride is to be mixed with strong anticoagulant. So the best answer here is the sodium fluoride EDTA. So when we do this particular question in detail, we'll be looking at the order of draw, and we're talking about each of the tubes, for which purpose it is used, what are the components within the tube. So we look at the order of draw in sequence, the different tubes, the components, the additives within the tubes, the purpose for which they are being used. So all of these we'll do when we look at the topic separately. Okay. Moving on to question number two. What is not considered in the diagnosis of metabolic syndrome? Now, metabolic syndrome has a very specific definition. There are 5 points within it. So, your options are hip circumference, HDL, glucose, hypertension. So, out of these, you have to know that HDL is required, glucose, hypertension, all of these are part of the diagnosis of metabolic syndrome. But what we have is the waist circumference, not the hip circumference. I'll show you the parameters for the diagnosis. So waist circumference, blood pressure, fasting triglyceride, the fasting HDL, and the fasting blood glucose. These are the 5 parameters which are required to diagnose the metabolic syndrome. So in this question, the hip circumference is the wrong option. The answer should be waist circumference. Okay. So in this case, the not considered in diagnosis is hip circumference. Question number three, glycogen phosphorylase is activated by. So your options are phosphatase, calcium, cyclic AMP protein kinase, and the glucose 6 phosphate. So here the best answer is calcium. Calcium will activate the glycogen phosphorylase. The others are likely to inactivate the glycogen phosphorylase, and rather they will act on the glycogen synthase component. We'll look at the regulatory components of glycogen metabolism and the glycogen storage disorders separately, because one of the aspects, either the glycogen metabolism or the glycogen storage disorders, is definitely asked in the paper. In which of the following genetic material adenine is not equal to thymine? Your options are herpes virus, E. coli, HIV virus, and hepatitis B virus. Okay, so what you have to remember, the genetic material adenine equal to thymine will be applicable when you have the double-stranded nucleic acid. Okay, particularly double-strand DNA, because the uh, thymine will be there in the DNA only. So as you can see here, HIV virus has the RNA as the nucleic acid, not the DNA. So here, this rule A is equal to T in the nucleic acid will not be applicable. Thymine is not there in the RNA. We'll take a look at this aspect separately when we talk about the Chargaff's rule. Okay. The diagram shows the mechanism of action of which of the toxins. The toxins are diphtheria toxin, ricin, puromycin, cyclohexamide. Now, generally, we talk about toxins separately in forensic medicine and to some extent in microbiology when we're talking about the bacterial toxins. But these three, four toxins, because of their very specific biochemical mechanism of action, are asked very commonly, and we discuss them in biochemistry also. Now, if you look at the mechanism, what you find that it inactivates elongation factor 2. The elongation factor 2 is the target for the diphtheria toxin. Diphtheria toxin is acting on elongation factor 2, inactivates the amino acid diphtamide by the ADP ribosylation. We'll talk about these four toxins when we are doing the topic of the toxins, the mechanism of action, how the translation can be affected, how it can be blocked in the prokaryotes and in the eukaryotes. So all these four we'll discuss later. Question number 6, based on the arterial blood gas analysis of a patient admitted to emergency, what is the diagnosis of the patient? The pH value is 7.28, the PCO2 is 80 millimeter of mercury, the bicarbonate is 28 millicoulombs per liter. Your options are metabolic acidosis, metabolic alkalosis, acute respiratory acidosis, chronic respiratory acidosis. Now, first thing is pH is 7.28, meaning it is definitely acidosis. So, alkalosis is out. Now, if acidosis is there, then either PCO2 level should be high or the bicarbonate level should be low. So, PCO2 level is high, but bicarbonate level is not low, meaning we are looking at the respiratory component. So, now we are looking at the respiratory component, metabolic is out. But if you look at the bicarbonate, instead of being low, it is going in the opposite direction. Now, going in opposite direction means compensation. Compensation means it is a chronic case because compensation will set in only in chronic conditions, not in acute conditions. So here your answer is the chronic respiratory acidosis. Now, this ABG analysis and the acid-base disorders is a short question in all the papers. So we'll be taking a look at how to identify the acid-base disorders, whether the anion gap is there or not, whether the compensation is there or not. All of these we'll discuss using a flowchart when we talk about the acid-base disorders. So don't worry about it. We will simplify this topic for you, and I'll make sure that all of you are confident when handling the acid-base disorder questions. You should also know about this Davenport diagram. It can be there as the image-based question. It is an easy tool to identify the simple acid-base disorders. Okay, it won't work when you have the complicated case of acid-base disorder. It works with the simple acid-base disorders known as the Davenport diagram. Again, we'll talk about this later. Which of the following is not useful for double-stranded DNA break? ATP, protein kinase, Ku protein, and MSH2. Now, this is something which is not expected from you at the PG exam level. Nevertheless, for the record, we just highlight that MSH2 is required for the mismatch repair. MSH2 is required for the mismatch repair, not for the DNA break repair. DNA break repair will include the homologous recombination and the non-homologous end joining. There we don't make use of the MSH2. Rather, the proteins required in the non-homologous end joining would be the Ku protein, the kinase or phosphatase, the ligase. So these are the molecules which are involved. Polymerase, obviously, polymerase. Without polymerase, the repair cannot happen. The reason for hepatomegaly in glucose 6 phosphatase deficiency is accumulation of glycogen flakes, accumulation of glucose 1 phosphate, accumulation of glucose 6 phosphate, and accumulation of glycogenin. Now, obviously, glucose 6 phosphatase is not there, so glucose 6 phosphate cannot be broken down. So, the cause for hepatomegaly is accumulation of the glucose 6 phosphate. Okay. We'll again talk about the different glycogen storage disorders, which enzymes is deficient in which condition. That part we'll discuss later. Obviously, glucose 6 phosphatase deficiency known as the von Gerkes disease. This is the type 1 glycogen storage disorder. The active site of enzyme is complementary to your options are transition site, allostatic site, substrate, and the product. So active site is the place where the substrate has to bind so that it can undergo catalysis. So obviously, first the substrate has to bind, if it has to be complementary to the substrate. Substrate is the best answer. Again, we'll talk about mechanism of action of the enzymes. That is one important aspect. Second aspect is the enzyme inhibition and the graphs. So those things we'll discuss later. 2,3-BPG binds to heme part of hemoglobin, globin part of hemoglobin, heme part of myoglobin, and the globin part of the myoglobin. So here the correct answer is heme part of, sorry, the globin part of hemoglobin, not in the heme, not in the heme. It is the globin part of the hemoglobin where the 2,3-PG will bind, and it will bring the four polypeptides in the taut state. With that taut state, that is facilitating the attachment of oxygen at the heme. In myoglobin, the 2,3-PG does not bind. Okay, so we'll look at this aspect, how the 2,3-PG is binding, where it is binding, what type of structure is required for the binding of 2,3-PG. All of these we'll see later. Hybridoma technology uses which pathway? I'm sure you know hybridoma is a technique used to produce monoclonal antibodies, and it is based on the identification of purine salvage pathway to identify cells where the purine salvage pathway is not working, and therefore they are amenable to be grown in the hat medium. So this is using the purine salvage pathway. All the cells show glucose uptake independent of insulin, except your options are brain, pancreas, adipose cells, and RBC. Now, glucose transport, and the glucose transport is again another commonly repeated question. Here, the answer is the adipose cells and the muscle cells, whether it is the cardiac muscle or skeletal muscle, require insulin for the uptake of glucose. So this is the table showing the glucose transporters, important ones. We'll discuss this in detail, look at all the aspects when we are doing the topic of the glucose transporters, one of the 60 topics that we're going to do. So that's all from the INI-CET November 2023 Biochemistry recall questions. Thank you very much. Please join us for the other recall questions. We are going to go right up to 2020 May, the last 10 papers we are going to do. Once we have done those papers, then we go on to the topics that I mentioned, 60 topics from the routine and 12 topics which have been asked once. So we'll not do a very deep dive in those 12, but for those 60 topics which are routine topics and have been asked frequently, we'll do a deep dive and make sure you are able to handle any question coming from those topics. Thank you very much.